Hello everybody, how are you? How are you doing? I believe you're doing so fine. So where are you reading from? Okay, I want to talk about a present situation or present issue where women believe they are pregnant, why they are not pregnant. Alright, and we'll call it medically pseudocyesis. What is pseudocyesis? Pseudocyesis, I've already explained, is a medical condition whereby a full-grown woman believes she's pregnant, having medical signs of early pregnancy and the rest of it, and then at long run she finds out that she is actually off, that she's not really pregnant. Okay, now we have to talk about the causes and the risk factors. All right, when we're talking about causes, the causes has a lot to do with hormonal fluctuation. So this hormonal fluctuation has to do with a situation whereby there are high level of progesterone and estrogen in the system, and once there is high level of that, you see a woman having a lot of signs of early pregnancy. You see her vomiting unnecessarily, having nausea cases, adding in weight and the rest of it. So when you have those situations, you find out that a woman completely believes she's pregnant. Do you understand? So in this situation now, what are we going to do for that same person to have her state very balanced again? So among the risk factors we are explaining, I believe you actually understand this part I'm talking about, the hormonal fluctuation. And secondly, we have to talk about the psychological effect before we run into how to manage it, how to actually address it and get this person back to normal. So whenever you find out that you are having those states, about 70 or 75% of women has passed through this gate before. So when you notice, when you actually start having these issues, I've actually talked about the fluctuation in hormones, progesterone, estrogen. So this point, you're having psychological state that is not stable. So when you talk about that psychological aspect of it or effect as a causative agent of pseudocyesis, is a situation whereby a woman might have lost some pregnancies. You understand, about 1, 2, 3, count it, pregnancies that she has lost. So it's anytime she start having some depression and the rest of it, psychological traumas pull her up and down. Do you understand? And that case, she finds out that she's thrown off balance, and because her mood has changed, it might actually delay her menses. You see, the menses continue to cease. She will not be having her flow every month. And at that point, she believes so much that at that point, you see, women will tell you that the pastor told us that she's pregnant. This is a witchcraft coven or cobwebs has actually shadowed your baby. Don't go to hospital. That so far, once you're 9 months, you're going to give birth to a baby. Please, let's come out of that and help ourselves. This is a psychological state. This is what someone's psychology can actually result to. Another condition that can actually result to this pseudocyesis has a lot to do with medical conditions whereby someone's thyroid is having some disorders. Another one is polycystic ovarian syndrome. Polycystic ovarian syndrome can actually be a situation where those follicles in the system helps and delays your menses, and at that point you start feeling some movement in the system as a result of those polycystic ovarian syndrome, and you think that you're pregnant. Now, understand that is a medical condition called pseudocyesis, forced pregnancy. Do you understand? Irrespective of the fact that you're still having those early symptoms that you are having when you were pregnant before, and you're still having the same experiences, please understand that your state of mind, your psyche is now working on you, and that is what is resulting to these symptoms that we are having. All right, so as we are talking about it, other things you have to see at this point has to do with the weight gain associated to pregnancy. You know already that any woman who is pregnant obviously adds in weight. Do you understand? Because of the hormonal changes that the person is having at a particular time. So as we're talking about that, we'll talk about the bloating and cramping the person is having. I've already explained that the cramping can actually be associated to the presence of those follicles that did not rupture, or polycystic ovarian syndrome per se. Do you understand? When you're having those follicles there, when you're having those cysts and you keep on having some breaks, you keep on having some movement in the system, and you're believing that is the heartbeat of your baby, your fetal heart at that particular time. Understand now that these are just your psyche working on yourself, on you, that is a forced pregnancy, which we labeled, which medical terms used to define it or explain it more is pseudocyesis. So now the nausea and vomiting aspect of it is not equally ruled out. You see a woman on this same condition vomiting, having nauseous state, vomiting everywhere, as if really that she is pregnant. Remember, as I started, I said the hormone fluctuation of progesterone and estrogen actually, once it's increased, result to all these signs. Understand it's a medical condition, and run out now so that you receive your treatment. The diagnosis is being done well, the evaluation that is being needed, and you get yourself back to normal. And now, as we're talking about it, we've talked about the fetal movement. Now let's talk about certain medical conditions that we can actually use in addressing it, and addressing it quick. So when a woman is having this, the certain diagnosis we actually need to do for the person to help the person is completely evaluating the ultrasound aspect of it. After palpating the patient, we'll go straight to ultrasound and make sure this patient sees the screen very well, to see so much that the womb is completely clear of any fetus. Do you understand that this person has actually been allowing herself to actually go deep in adding weight, because there is increase in appetite associated to a pregnant woman, and this very person keep on increasing in size, and the right ring of the stomach keep on increasing, the bloating and the rest of it, the stomach keep on increasing. So once it's identified, evaluation with that your image, your scan helps this person to rule out this. Another way to manage it, to diagnose it, as I said, is the palpating of that same patient's stomach. Now, in managing this very situation, we have to talk about the psychological distress of this person, trying to pull the person out of the situation. How do we do that? What we do now is to work on this person, counsel the person, give appointment to this person, work on this person. As you're working psychologically to maintain the state and bring this person back to normalcy, you start working on whatever issue that results to her not taking in, whatever it is that is delaying her pregnancy. If it's associated to hormonal imbalance, do hormonal assay and do thyroid function tests, and be able to pinpoint whatever her issues is, and make sure to take in within 1 to 3 months of this very medical condition. If possible, the person takes in that same month, and you see the person heal back. This is just associated to most of the abortion that has come. Do you understand? This idea of miscarriages and the rest of it, pretend birth and the rest of it. So now, once this is been identified, the help of this very patient comes so good, and she takes in again. You see her balance back. So what her case is the issue of having baby. By all means, being able to help her through this very journey, and her regaining her pregnancy, regaining pregnancies that she has lost, to make her heal again. And at this point, some of the marital issues arising to the marital issues surrounding this pseudocyesis, the situation whereby she's thinking the husband will get married to another person, or she will be thrown out of the family. Counseling her and counseling her husband will allow her take in and maintain the mental state, and allow their hormones to function well. Thank you. As you continue to subscribe, we'll bring more of this to you and help you heal fast. Thank you.